Assalamualaikum doctors. In this video, I am discussing autism history management. So first, assess the other developmental delay. Refer to the Child Developmental Center for assessment. I will measure the vitals and plot on the appropriate chart. Formal vision and hearing assessment, plus minus genetics and others. Multidisciplinary team. I will involve my consultant pediatrician, developmental pediatrician, cognitive behavioral therapy, and also 2 to 4 year intensive behavior interaction course. Then parent mediated interventional therapy, computerized educational program for parents, close observation and follow up of the child, and computerized questionnaire. So these are SALT, speech and language therapist, education healthcare planning, occupational therapist, sensory processing disorder and comorbidity. They will do other specialized accordingly. So this is the management. First, I will assess his developmental delay, other domain, then child developmental center, then height, weight, vital measures, plot appropriate growth chart, formal vision hearing assessment, then multidisciplinary team we will involve. What are the normally autism comorbidities associated with ADHD, attention deficit hyperactive disorder? So here what we find, that is the child is on go, he is not stopping, he is answered the question before asking. And autism, we know that no eye contact and he lives on his own world. Then sleep problems, language problems, nutritional problem, vision and hearing problem. Drug therapy and autism are nothing specific for autism except if associated with ADHD, anxiety, depression, self-harm, seizure and sleep problems. That is melatonin if more than 12 years. So autism, this is multidisciplinary team I am telling. Autism are pediatrician, developmental pediatrician, cognitive and psychological assessment, liable to psychological problems, and mention then cognitive behavior therapist will involve. Educational worker, education healthcare plan, liaison with the school, SALT, healthcare visitor, social worker, genetic syndrome, and other according to case. Neurologist for seizure, physiotherapy, orthopedic, ophthalmology, ENT, and cardiology. Causes of autism in DD are no specific cause, but some factor increase the risk factor. When we take the history, we will keep this in our mind. The preterm, so birth, during birth, preterm less than 35 weeks. Other sibling with autism, lead poisoning, inherited developmental disorder, thyroid problem. So thyroid will ask CNS infection, hydrocephalus, inherited metabolic disorder, phenylketonuria, aminoaciduria, homocystinuria, syndrome or West syndrome, neurofibromatosis, tuberous sclerosis, fetal alcohol syndrome, Prader-Willi syndrome, Fragile X syndrome, Down syndrome, Williams syndrome, Sotos and Angelman syndrome. So this is autism history management. Thank you.